Hello and welcome to Digital India Summit, a premier initiative by Times Network. Now, this year, our theme is enabling a revolution. And well, technology has enabled a revolution, especially during the pandemic. Now, today, we're going to be talking about a sector that has been transformed by digitization, the healthcare sector. Well, it's a no-brainer that this sector has been one of the top sectors to have been transformed during the pandemic. But truth be told, the winds of digital change had already started blowing long before that. So to talk to us in depth about transforming India's healthcare through digitization, I'm joined by a panel of experts. Allow me to introduce them. First up, we have Meena Ganesh, co-founder, chairperson, and MD at Portia Medical. We have Pankaj Sahani, CEO at Medanta. And we have Prashant Tandon, the CEO and co-founder at Tata 1mg. Ma'am, gentlemen, thank you so much for joining me here. Ma'am, I'd like to start with you. Like we've spoken about also earlier, the pandemic has resulted in the development of more holistic models of healthcare delivery, thus enabling care like telemedicine, teletherapy, all of this has come into place. Your thoughts on how you've seen this develop, the importance of this, the benefit both to the patient, to the customers, as well as to companies?
Very good point you make, Sumit, that during the pandemic, this has really taken center stage. I'd like to come in from 2 or 3 perspectives. One is, of course, just health and wellness, and tracking your activities, tracking your health, to use wearables and all of that. So that is one segment. The second is a quick access to medical help for people who may have any primary issues, etc. So we've seen teleconsultations boom in that area. The third area is on better utilization of healthcare resources. For instance, especially as an outside of hospital healthcare company that we have, we tend to send various kinds of healthcare workers into people's homes for different kinds of support. They may need physiotherapy, or they may need nursing support, or they may need a doctor to come and visit them. But use of technology, both at the patient end, which is maybe use devices which are connected, plus having a remote set of experts, what it does is that the same resource is now able to deliver a much more useful and much more comprehensive service, comprehensive medical treatment to the patient. And that is a big transformation that we believe in our sector. It's a digital solution that becomes much more meaningful to them. The patient sitting at home, sitting in the comfort of their community or home, is able to get a much better quality of healthcare than ever before, because they are able to use a combination of devices, people, and back-end medical experts through the digital method to make this happen. So that's one transformation that we are certainly seeing.
On that point, I'd like to bring in Mr. Sahni, because sir, at Medanta with a hospital, how are you seeing technology being used in different areas to help better services to patients, so that, I don't know, their wait time is less, or maybe they have to come fewer times to the hospital? How are you deploying technology at Medanta to bring this angle in?
See, technology is not new to healthcare. Neither is digital, neither is some of these buzzwords which we are hearing now. Only thing that's happened is that now a lot of the packaging has happened, and that's why you find things happening more in the nature of buzzwords. But technology has been around in healthcare for a long period of time. Before I get into what exactly is happening, I think it's very important to understand that when we talk about technology, digitization, etc. in healthcare, it is very important that we ensure that this digitization on technology is happening to ensure that we continue to build on that fundamental trust-based relationship between a doctor or a care provider and a patient, and that we are not using technology to bypass this relationship. It should add to this relationship. And that is the approach which we follow at Medanta, and that is the approach which we believe will be successful. So there are 3 or 4 areas specifically where technology can play a big role. The first, and I think Meena also touched on this, is fundamentally around access. So the way in which I think about access to technology is that you have the ability to use technology to be able to overcome geographic barriers of access. You can use technology to do things like skill shifting, where you can get a nurse to do part of the job which maybe otherwise a doctor was doing. The second important area that it allows for is around efficiencies. And those efficiencies are things that you mentioned, whether it is wait time, whether it is being able to, in your own hospital or in your own healthcare provider, actually become more efficient. And the third big area is around patient quality of care. So you are now providing doctors with tools that will otherwise they didn't have in the past to be able to elevate the standard of care that they give. So to summarize, Sumit, in three broad buckets, the way I classify this is: one is access in all its shapes and forms, including geographic informational access. The second is around efficiencies. And the third is around elevating the quality of care. This is how we think about technology, and all the while making sure that you build this around the doctor-patient relationship.
Mr. Tandon, one important thing that has happened during this pandemic is people have gotten used to ordering medicines online. I mean, earlier we used to call up the chemist, but now we're easily doing all of this online on an app, on websites. Your experience in this, and how has digitization helped in this shift from accelerating this contactless treatments, and people are just quickly taking these decisions of ordering the right medicines and having them delivered to them rapidly? This mindset change, how's it been brought about, and how have you seen it develop?
We've been in operation for over 6 years now, so clearly we believed that for access, technology can play a big role, and for patients who need access to their healthcare, be it pharmacy, diagnostics, or consultations, it's great if technology can be leveraged and patients can get it where they need it, when they need it. And I think what the COVID pandemic kind of underlined or brought to light a lot more was it showed that it's actually much safer for everyone. Also, what it helps a lot with is the balancing of supply and demand. Many times we had huge shortages of medicines in certain parts of the country. And what technology and digitization can do is actually bring a lot of transparency and visibility to make an efficient supply chain, to make these products and services available where they are needed, when they are needed. So I think that back-end kind of impact of technology is often not fully appreciated, but it's very, very important. And I think going ahead, what we are going to see more and more is now, due to the pandemic or post the pandemic, all the stakeholders have a much better appreciation of how technology can help them serve the consumers better.
Absolutely, yes, that is truly one of the bigger changes that has come about. Ma'am, one concern that sometimes people are waking up to right now is data privacy. We've spoken about a lot in other sectors. It's obviously very important here in the healthcare sector. And I'll come to all panelists on this. But ma'am, I'd like to start with you. Your thoughts on this. What are the steps that are being taken by industry on this? And how would you kind of guide patients who are watching us on this important point?
It is not that data, in the physical world, the data had a huge amount of privacy or security, but the facility with which it moves in the digital medium makes it easier for people to lose the privacy of their data. And this is of course a big concern, and we need to, at each provider has to work for themselves till such time there are common standards and a common platform on which the data is being shared. Each of us has to ensure that we do whatever it takes to keep our patient data private. Now the problem will come when this becomes much broader across multiple providers, and providers of different sizes and shapes, not all of which take this matter as seriously. That's when a lot of leakage can happen. And we have a number of different providers who've jumped in, whether for medtech providers who do devices or teleconsultation, or they do different kinds of services for patients. I'll give you a simple example. If an insurance company, for instance, gets to know the kind of diseases that people will have, what will be the implication on the kind of premium that you would then be subjected to? So the data has to be not just private, it also has to remain in the right bucket, and individuals people who own whose data it is need to have the full ownership and the ability to decide what and when they share at what point in time. So I think we have just started the journey of digitization, and this is going to be one of the biggest challenges that the country will have to manage in times to come.
Mr. Sani, same point to you, because as a hospital, you've got different hospitals across different locations. But yes, it's important that data be shared there. And with the digital health ID mission, the digital health mission that the government's talking about, how will this change things for hospitals?
A couple of points, Sumit. I think it's very important that Meena mentioned earlier that we as a country or as a society never really paid too much attention to privacy. We only start to get worried about privacy when we feel that possibly somebody else is making money off that data of ours. Otherwise, there is no concern on privacy. So I think it's an important point that Meena brought out. But just 3 or 4 basic bullet points, right? The first, of course, is that when it comes to the ability to deliver care to a particular patient, it is very, very useful that you have the complete medical history of that patient. And the complete medical history of that patient can be reviewed by the patient's care providers across the lifetime of that patient. So what we call the longevity of data. Now, one of the challenges is that as a society, and this is not only true in India, but this is true for healthcare globally, we've always felt that this data belongs to the hospital or to the care provider. Actually, the fundamental shift needs to be that this data belongs to the patient. It is a patient's data and the patient that is sick. And I think one of the things that the National Digital Health Mission is trying to do is actually reorient this thinking towards saying that actually this data belongs to the patient and the patient should have access to this data. And the patient should be allowed to decide who sees this data to be able to ensure that the patient get treated in the best possible way. This is very, very important. Now, the third aspect of this is around ensuring that when you want to use this data for things like population health management, for things like research, for things like improving the quality of care or improving innovation, here it's very important that we ensure that this data can be used. We need proper guidelines in place. Of course, it should be anonymized data so that you are not actually violating the privacy of any individual, but simply saying that this data should not be used, in my opinion, is not the correct approach, because that is how we are able to generate innovation in healthcare, and that is how we are able to ensure that we are able to improve the quality of care for the whole society. So we need to think about, number one, making the patient owner of this data and educating and improving this amongst patients. Number two, making sure that whenever data is shared for things like research or improvement in healthcare or innovation, it is anonymized. And lastly, and possibly also Meena touched on this, is that in India today, very, very, very small percentage of healthcare providers actually even have data. 90% or more of the data would still be in paper forms, which patients maybe carry around in a bag. So there is actually very little data. And even the institutions which do have this data, it is very often not in an analyzable form. So I think that we are on a very, very long journey before we can suddenly say that this data is magically going to change healthcare. But it is a very important journey, and it's very good that we as a country have started on this journey. And I think the National Digital Health Mission is one of the right steps in that direction.
Mr. Tandon, at Tata 1mg, I want to talk to you about how you're using data because to give better product services, because you're not just catering to the large cities. You're across around 2,000 towns and cities across the country. So you're reaching to smaller towns, smaller cities. How is this data helping you to get the better products, better services to those people in efficiently and as well as quickly?
Sure. So see, as a digital medium, the amount of data, every interaction is data, and every interaction tells us something about what the customers are feeling, what they are looking for, and that data in different multiple levels helps us create better products and services for the consumers. Now, where does it start? So I think what we are moving towards is making healthcare will become much more personalized, much more life cycle oriented and long-term care oriented. And for that, a lot of data and Pankaj alluded to that, making those models happen. The You need data over a long period of time, over a large set of users, and you learn a lot from that. What are the trajectories that the patients are following, and then what are the critical inflection points where there are signals that the person may be headed into a situation that is a little concerning, and an intervention is needed. Now, all those modeling, all that, it's a long journey. And however, what we have seen with early signs of data is that we are able to create these long-term care plans, 6 month, 12 month. Just stay on a diabetes care plan, and you are at the end of the year, we will come with interventions or come with suggestions that can help you manage. And another thing where data comes very, very useful and handy, like for right now for COVID, if you look at our trends city by city, the just the sale of thermometers and COVID related products and paracetamol and medicines is very clearly, we can see which city is going up, which city is going down. And it's very fascinating that all the data is available, and you can start building more predictable models, and you start understanding that, okay, this city is at its peak, it's plateauing, this city has started coming down, because this is actual users on the ground uh, getting the healthcare they need on a platform that is now at a certain amount of scale. So we've started understanding that better, and what I was mentioning earlier, that helps us prepare our supply chains better. Tata 1mg, we are actively working. We are trying to make sure that healthcare is as personalized, as predictive, as preventative as possible, so that we can move and be where the consumer needs us to be.
Mr. Tandon, I'll come back to you on that predictive bit, because I have one question that I want to ask, but I just want to come to Meena ma'am. Obviously, this space, the whole med tech or healthcare, whatever we call it, med tech, I think it's called now. It is seeing a lot of startups coming up here to kind of use technology to disrupt or to transform, whatever the word we want to use. What are some trends that you are seeing for the way ahead in this space with new companies, new startups coming in?
So there are 2-3 different kinds of startups that we are seeing. One is people who are building devices. So there are different kinds of devices, whether wearables or medical grade devices, which can capture specific data. Could be for primary care, chronic disease management, or support for patients who are very sick. There are multiple startups that have come in this particular area. The other is in the area of using machine learning and AI, either for diagnostics or for support for patients who are diagnosed with certain disorders. That's another area that we are seeing. And the third, of course, is actual provision of service through technology, which could be just digital support, just teleconsultation or remote monitoring of patients, or any other kind of services that can actually be provided through technology.
Mr. Sahni, is this phase of this pandemic has taught us a lot. The phase of the pandemic has taught us a lot, and obviously technology, like you've also earlier spoken, plays a very important role in healthcare. Do you see the hospitals of the future evolving, changing? For example, what I mean is right now hospitals need to be these mega institutions, mega building complexes. Maybe in the future, a lot of the consultations would be happening online. So hospitals need to just have those core functions at ground there. So do you see that or any other changes because of technology coming in? Do you see any changes coming for the way ahead for the future?
Yes, I think that many changes will come in the way in which healthcare is delivered. And I think that this actually had started even before the pandemic. So actually at Medanta, we had started some of these efforts even much before. And it is not only about technology, it is also about fundamentally thinking about your operational processes. I think more than anything, Sumit, what has happened is the pandemic has actually opened up people's eyes. So I would actually say that the technology, the techniques, and maybe even the patient mindset was actually ready for this much before the pandemic. Probably what has happened is us in the healthcare industry, we are the ones who have actually opened our eyes, realizing that the pandemic has shown us that it is possible. So there were people who were maybe otherwise hesitant to look at things like remote care or telemedicine. Suddenly those people are also looking at it because there is no choice. However, my thought is that healthcare delivery, whether in a hospital or in a primary care center, is fundamentally changed, and it is going to continue to change. And there are 3 or 4 things that are going to happen. The first thing is that earlier, and this is again true globally, we always used to look at a concept of what I say, where we used to bring the patient to the care. And now we have reoriented ourselves and said, can we take the care to the patient? And that is around many of the things that you see with respect to technology, with respect to home care, etc. The second thing that's happening is that we are looking at servicing the patient across the continuum of healthcare. So if you look at the healthcare industry, again, globally, we call ourselves a healthcare industry, but actually we are much more a acute disease management industry. We practice very little health. So what we actually do is we are very, very good at treating disease, and we are not necessarily that good at keeping people healthy. And so what happens is that over time, you have seen healthcare providers start to look at a little bit more around the preventive space, early detection, etc. Now, with the use of technology and with this mental shift, we will start to look at treating the patient across the entire continuum, starting with preventive care, starting with things like wellness, mental well-being, physical well-being. So you will take the entire life cycle of a human being and you will start to manage it. So my personal point of view is healthcare delivery, the way we understand it, is fundamentally going to be different. What we knew earlier is over, and there is a new way, and we all need to become ready. And it is not just people like who you have on this panel, doctors, nurses, patients, industry, society. We all need to reorient ourselves around thinking that there is no such thing as healthcare without technology, without digitization. It is just a normal way of the delivery of care. And this fundamentally is going to shift as we move forward.
Mr. Tandon, one last question to you. Like I said earlier, I'd come to you on the predictive part. Do you see the way ahead where organizations like yourself might coordinate, cooperate, collaborate with government authorities to see that if you, in an XYZ location town, you're seeing more orders for a certain medicine, you kind of like intimate the health authority of the government there, saying that, hey, listen, this is a trend that we are seeing. Maybe the government needs to step in to do something.
Absolutely, it's going to be more and more useful for public health going down the line. Whether it's platform like ours, whether it's Google, whether it's a lot of platforms, and once you get to aggregate data at scale, it tells a lot. And I think the government itself, through the Ayushman Bharat Digital Health Mission, is going to access a lot of such data. And I think the good thing that I'm seeing is that there is intent and positive desire at the part of the government to actually engage with the private sector on some of these new initiatives. So I think we will have much better disease surveillance systems, and as a platform at a certain kind of scale, we would be very, very, very happy to contribute to that.
Absolutely. Well, that's all the time we have. Unfortunately, I would have loved to have a longer conversation, but that's all the time we have. So thank you, Mr. Tandon. Thank you, ma'am. And thank you, Mr. Sani, for coming here and talking to me about transforming India's healthcare through digitization. This was a special episode on the Digital India Summit. Thank you so much for talking to us.